We've all felt the sudden urge to pee before, and remedied it by dancing around, crossing our legs, and finally getting to a restroom. But while many people have their bladders under control, a large portion of the population isn't quite so fortunate. The condition at play here is known as overactive bladder, or OAB for short. It's a very common condition that affects up to 40% of women and 30% of men in the US, according to the Urology Care Foundation. But despite its commonality, there are still many misconceptions about OAB, mainly because this condition isn't talked about enough. Here's everything you need to know about overactive bladder. What is overactive bladder? Overactive bladder, which is sometimes referred to as polyuria, is a condition that causes the bladder to squeeze out urine at the wrong time. Unfortunately, doctors aren't quite sure what causes this condition. Bilal Chugtai, a urologist at Weill Cornell Medicine and New York Presbyterian, explains.
When it comes to overactive bladder, there is no real known cause. So for what we call idiopathic overactive bladder, that basically means that there is no cause, but there are patients who have what's called neurogenic overactive bladder or neurogenic bladder, and that is they'll have a neurogenic cause for it. So in other words, they can have like conditions like multiple sclerosis, conditions like Parkinson's. Those conditions can have a known cause for why they'll have urgency and frequency.
What are the symptoms of overactive bladder? If you experience at least 2 of these symptoms, there's a chance you're suffering from OAB. Urinating at least 8 times during the day or at least 2 times during the night, feeling a sudden and strong need to urinate immediately, or leaking urine after experiencing a strong urge to urinate.
So there are patients in their 20s and 30s that can have overactive bladder, but it's typically a condition that we see as both men and women get older. So the symptoms tend to progress over time, and people will have worsening urgency, worsening frequency, even to the point where they can't make it to the bathroom where originally they could.
Another problem occurs when people are repeatedly misdiagnosed with urinary tract infections. Doctors who aren't specialists might mistake bladder symptoms for those of a UTI and end up diagnosing their patient with a UTI multiple times when they've actually been suffering from OAB. Because of this, it's important to consult a urologist or urogynecologist if you think you're suffering from overactive bladder and your symptoms persist. The diagnostic process for OAB is simple. A urologist can diagnose the condition after asking questions about the symptoms you've been experiencing. And while young people experiencing symptoms might not consider themselves at risk, it can certainly affect individuals in their 20s and 30s. How is overactive bladder treated? The good news is that there are many ways to manage OAB. To start off, simple lifestyle adjustments can help better control symptoms.
The first thing I have patients do is we talk about the role of dietary changes. So avoiding things like coffee, tea, acidic foods, spicy foods. And what I try to tell patients, like, it's not a punishment that I'm trying to give you. I'm not trying to take away foods that you enjoy, but there's certain foods that are known to exacerbate this condition.
Beyond that, there are oral prescription drugs designed to relax the bladder that are used to manage OAB, and doctors might also recommend pelvic floor exercises to patients. In addition to these treatments, there are also more intrusive procedures. Some OAB patients have Botox injected into their bladder, which essentially paralyzes the bladder. Doctors also can perform a procedure to calm down overactive bladder by sending an electrical signal to the bladder via the insertion of a small needle in the ankle. So while there aren't any known cures for OAB, a variety of treatment options can work together or singularly to lessen symptoms. Overactive bladder is more common than you think. Even though it's often misunderstood, there are resources and support groups available trying to change the dialogue around OAB.